What do you believe is causing the surge in these cases?
Well, I mean, there are a lot of causes, but what's being highly evaluated, was being considered the main reason, is the fact that we're pretty much going back to normal. And what I mean by that is, prior to the current time when things got better, which they have, they're starting to get worse again, but we were following those mitigative measures as far as wearing our mask. We were social distancing. The schools were doing an excellent job. But when things got better, we started going back to normal. You see people going to large congregation events such as sporting events, children playing together. And then you have to think about the fact that a great deal of time went by where people didn't contract a lot of problems and their antibodies were lower. But now that we're coming back together, it's just all of a sudden everybody's exposed to so much, and now the infection rates are going back up.
Dr. Quinn, is there a certain age range that's more vulnerable to the virus right now?
Well, of course, you have to look at your vulnerable population, and that's going to be your elderly population, because they typically have a more compromised immune system. In this population, more people have chronic medical conditions that could cause a person's immune system not to be as strong, such as long-term diabetes, heart disease, lung disease, COPD, and so on and so on. And plus, as we get older, like myself, our immune system just is not what it used to be. But we also have to think about our very, very young, our infants, babies. Their immune system is not going to be as strong as an older kid. So we have to take all that into account, and also celebrate that we can now vaccinate children as young as 6 months of age. So I highly encourage all parents, if your children have not been vaccinated, contact your medical provider and get them vaccinated, because the vaccines have been proven to be effective and safe.
Dr. Quinn, do you think this current surge will be over by the time school starts?
I hope so. The entire medical community, the whole world, we're all hoping that this current surge that we're currently experiencing will cease, not continue. But in the meantime, a lot of organizations such as the CDC, all these organizations, they're looking at bringing back some of these mitigative measures, such as going back to mandating that people wear masks out in public. There's more social distancing, and maybe counseling a few of these large gatherings of a lot of people together. So these are things that we'll be on the lookout for. And if they do become something that we have to do in the future, we have to understand that, it's something that we have to do, because we definitely don't want things to go bad again and people to lose their lives.
So kind of sum it up for us, Dr. Quinn, what's the best way for parents to protect their children right now?
Well, as I said, the best way for parents to protect their children is to use what's been proven effective and safe, and that's vaccinating our children. I mean, just a couple of weeks ago, the CDC, the FDA, they approved it. Children 6 months of age and older can get those vaccines. So let's get our children vaccinated. And also, if you have a child that contracts coronavirus, get them evaluated by their medical provider. So if they do have it, they can be diagnosed. And also know you can do testing at home using the test in the pharmacies. And that way, if somebody has it, they can be separated from everyone else. We now have treatments, and we can cut down on the spread.
All right. Dr. Timothy Quinn, thank you so much, as always, for being with us.